She's an acupuncturist in London in the UK and also in Israel, and she's a research acupuncturist. She's here presenting her perspectives on endometriosis this afternoon, so everybody give her a nice warm welcome.
Thank you. I'm going to repeat what I said yesterday. We're going to go through the role of acupuncture in treating endometriosis. I know you've heard a lot, but I'm going to try to give you my perspective. We're going to go briefly through the Western medical perspective. I'm going to talk a lot about the 4 phases. I like to, when I approach endometriosis, patients with endometriosis, I like to use the 4 phases when I tailor their treatment. And when I treat a patient with endometriosis, when she has pain, I'm not just treating her for the blood stasis, for the kidney yang shu, whatever it is. I always try to consider how do I support her mentally, adding pericardium 6 and stuff like that. We're going to go through it. Okay, so endometriosis. The cysts, by the way, they don't look like that. They're more nasty and disgusting than this one. Here you can see when we say chocolate cysts, that's how they look. All right, endometriosis is a condition resulting from a presence of actively growing and functioning endometrial tissue in location outside the uterus. The layer of the tissue that normally covers the inside of the uterus grows outside of it, most often found on the ovaries, the fallopian tubes, and in some cases in other parts of the body, and could be found in sites of abdominal surgical scars, such as from C-section, hysterectomy, ectopic pregnancies, etc. By the way, I have a very bad Israeli accent, so if you don't understand anything, let me know. Although I said yesterday that since Gal Gadot became Wonder Woman, I feel more peaceful with my accent. Endometriosis' main symptoms are pelvic pain, chronic pelvic pains, pain during menstruation, pain during intercourse, and infertility. Pelvic pain can be mild or severe cramping either on one side of the pelvic or on both sides, as well as pains in the lower back and rectal area. I said in stage 1 and 4, look by the way what happens to the yin and the yang in the 4 phases. That explains a lot the temperature of the body. Stage 1 and 4, move blood to the uterus, work on the Chong Mai. I like to use spleen 4 and pericardium 6, kidney 14, stomach 29, and spleen 6. Stage 2 and 3, I work on the Ren Mai, lung 7, kidney 6, it's not IS, it's S-iced, small intestine 3, and bladder 62. Let's go back. All right. Yeah, treatment principles. Always find out if it's a cold or a hot condition. If it's cold, use moxa, warm nutrition and spices. I like to tell my patients to use turmeric in their nutrition. Turmeric, cumin, even cinnamon. If it's a hot condition, I like to use spleen 10 is to cool the blood and stop the heavy bleeding. Regulating the masses according to the 4 phase. It will help to regulate the woman's body temperature as well, especially if she's trying to get pregnant. Warm the uterus even if there aren't any cold symptoms to ensure the growth of young, especially during phase 3 and 4, but not in case such as liver fire or damp heat. To deal with the pain, choose points as to calm the heart. Oh, don't forget, if the patient has long-term pains, if there are stabbing pains, if there are horrible pains, any kind of pains, it will affect her mental stability. Don't ignore that. Many women with endometriosis suffers from hormonal acne or with excessive facial hair. We tend to see it in PCOS, but I had some cases of endometriosis with that. In that case, please treat the Chong Mai. You can add spleen 6, bladder 23, stomach 30, kidney 11, 21. Now, some acupuncture points to treat blood stasis. Okay, we have spleen 10, kidney 14, pericardium 6, bladder 17, liver 3. I think you have the whole list, but a couple of them I'd like to talk about. Okay, later. We have acupuncture points to treat kidney shu, and we have acupuncture points to treat damp phlegm. I personally like stomach 28. In Chinese, on the left side, it's called Bao Men. It's the door of the uterus. And on the right side, it's called Zihu, window of baby. This is one of my favorite acupuncture points. Liver 3 and kidney 14, those are for me the most important when you treat endometriosis, as they're moving the blood. Liver 3, the Tai Chong, As they say in the I Ching, when a girl is 14, Tiang Wei arrives, the Renmai is open, the Tai Chong vessel is flourishing, menstruation begins, and she can conceive. So we don't want any 14-year-old girl to get pregnant, but this liver 3 Tai Chong is very important. This point is closely related to Chong Mai, and when used, it activates the Chong Mai and invigorates blood. That's why I like to use it. The big question, how do we approach a patient who suffers from endometriosis, hence blood stasis, it's the biao, but also treating the underlying condition, the BEN, which is normally a SHU deficiency. Since endometriosis and blood stasis are chronic conditions, we need to treat both BEN and biao simultaneously. I personally prefer to start breaking blood, invigorating the blood, eliminating the stasis as to improve the patient's pain if she's in pain, and parallel or after that to treat the deficiency. The method of invigorating blood, we have to move qi, we have to tonify qi, we have to nourish the blood, warm the masses and scatter the cold, clear the heat of course, move downwards, resolve phlegm and soften the hardness. When I say move downwards, in Israel they do workshops for women with endometriosis. There's a special unit in each hospital for endometriosis, and they do workshop of yoga and belly dancing. They found out that the movement of belly dancing and the lifts of the yoga are very, very good for endometriosis. Do they do it here in Canada or in the States? Do you have any special units for endometriosis in the hospital? You don't do it? It's something to work on. All right, we have different patterns in TCM. We have liver blood stasis, intense sharp stabbing pain related to the woman period. Such pain will normally affect the woman's mental stability. The period will be dark bleeding with large clots. The tongue will be purple. The pulse will be wiry. The treatment, invigorate blood, eliminate the stasis, stop the pain. Well, we want to stop the pain. We can't always stop the pain. Acupuncture, you don't have to do all of those acupuncture points. Those are just suggestions, okay? Cold stagnation, lower abdominal pain related, whoops, here you go, almost broke it. Lower abdominal pain related to period, scanty bleeding, blood will be bright, red possible with dark small clots. By the way, I always tell my patients, they all have smartphones, to take pictures of their period. I know it sounds funny, my children knows not to go to mommy's phone. I have terrible text messages and my WhatsApp is filled with rubbish pictures, but tell your patients, take pictures and send it to you so you can see the period, you can see the bleeding, the color, if there's any clots. It's really important. Even if they have any discharge, tell them, don't be shy, take pictures. Honestly, you should see my phone. Take pictures of your period, of your discharge. It will help you to see the whole picture, okay? The patient will feel cold and the pain will get better when heat is applied, such as hot water bottle. The patient may complain of back pains. The pulse will be deep, choppy or wiry. Treatment, warm the uterus and expel the cold, invigorate blood. That's where you should use the Moxa box. I'm telling you, please try and use it. It really, the patients love it. They just sit there with it in between their legs. Acupuncture points, I like those, and I like to use Moxa, sometimes direct Moxa, on the location of the acupuncture points, some of them. Okay, especially CV4 and CV6 or stomach 36 with direct Moxa. Let's see if there's something I wanted to... Yes. By the way, I said to you to get the whole picture, to ask your patients to take pictures of their periods and their bleeding. Another thing that I do, when I do questioning, it takes me a long time. I'm trying to gather all the information I can. If they tell me that they have pain, I always like to know what kind of pain is it? How bad is it? How bad is it on a scale of 1 to 10? Because sometimes a patient can tell me, I have terrible period pains. And when I say, okay, on a scale of 1 to 10, how bad is it? She said, oh, it's about 4. And then I said to her, and after you have your period, how bad is the pain? I said, oh, after the period is 7 or 8. It can tell you to know what's going on, okay? I tell them, tell me, what is the nature of your pain? Okay, is it stabbing? Is it a dull pain? Again, all that gathering information helps me to do the right diagnosis and to know the whole picture. Damp heat, hypogastric pain before the period could appear with burning sensation extending to the sacrum. I did have some patient with damp heat that presented some heartburns. Okay, menstrual blood will be red with small clots. The patient may feel thirsty and will normally report of vaginal discharge. The tongue will be swollen, the pulse will be slippery. Treatment, clear heat and resolve dampness. Eliminate stasis. Those are the acupuncture points. I added here large intestine 11 because it's very good for damp heat. It treats damp heat. Bladder 22 to resolve the damp, and kidney 2 to clear the heat. So those are the ones that I like to add when I treat this. Damp and phlegm in the uterus. This is a more painful period. Abdominal fullness, heavy feeling, excessive vaginal discharge. I had a patient very recently. She's my daughter's ballet teacher. And although she was very, very thin and tiny, she said that she felt very full and heavy. And actually, she had the whole thing by the book. The tongue swollen with sticky coating, thicker on the root. The pulse slippery. The treatment to resolve damp and phlegm and to move qi. Acupuncture, those are the acupuncture points. I love CV12. By the way, I like to stimulate CV12. I don't do laser therapy, but I like to manually stimulate CV12. And sometimes the patients say that after she goes to the toilet, there's a lot coming out, a lot of discharge. Damp and phlegm in the uterus, painful period. Let me see, sorry, it's what we had. Yeah, kidney yang deficiency. Abdominal pain relieved by pressure or with applied heat. Water retention and bloating. It's not blowing, it's bloating before the period. Patient may suffer from dizziness, tinnitus, depression, feeling cold, and have backaches. The period, the blood will be pale red. Have you ever seen a pale red period? It's very different from a normal. It's more pinkish. It's more pinkish whitish than a really truly red period. The tongue will be pale and wet. The pulse deep and weak. The treatment, tonify and warm the yang. Kidney yang deficiency. When I say stomach 36, I always do it with moxa. GV4, I like GV4 for this kind, for kidney yang deficiency because it's the main point for tonifying kidney qi and yang. Bladder 32 for blood stagnation and kidney shu, also very good with moxa.